Good afternoon, everyone. Welcome to our Q&A time with the media, where we answer questions related to COVID-19, but also start by giving an update on what's happening in Eau Claire County and across the state related to the COVID-19 pandemic. We'll give some basic data as we always do. We will provide a few updates that have happened statewide and then answer the media questions that we got in advance, as well as any questions that come in via the chat. Thank you to Audrey for joining us so that she can moderate that chat. So to start with, we will start with our Eau Claire data updates. A reminder that our COVID-19 Eau Claire .org website has a lot of data on it. That data is related to cases and deaths, as well as related to vaccination. And more data gets added regularly, more links to our state data get added, and we really encourage people to check that site out for more information. Some basics for you today. Our individuals that are Eau Claire County residents that have tested positive for COVID-19 are now at 10,815. We've had an increase of 143 positive cases since last week, Thursday, when we spoke with you last. It's an average of about 20 cases a day for the past 7 days. Our goal is again 10, but this 20 case a day average is considerably better than what we were seeing in late November and through December. So good news for Eau Claire. Also something that's being seen in most places statewide, not everywhere, but certainly our case numbers across the state have also been significantly better in the last couple of weeks. Our active cases are now at 236 Eau Claire residents that are staying home because they are COVID positive and their close contacts are staying home. So we have slower spread of COVID-19. 345 individuals have been hospitalized with COVID-19 since the start of the pandemic, an increase of 5 people since last week, Thursday. And we now have 104 Eau Claire County residents, our family, friends, neighbors, who have died related to COVID-19. 6 more people since last week when we spoke to you last. A couple of other data points that we share with you, typically weekly. First of all, our jail testing data. We started many months ago sharing the testing data with you for those connected to the Eau Claire County Jail as part of our work with them to provide clear and updated information on COVID-19 in that space. We'll no longer be using part of our time with our Q&A to do that because the jail, through the Sheriff's Department, does have really readily accessible data now available on their website. So I strongly encourage you to go to there if that's something that you are tracking. Again, visit the Eau Claire County website. On that website page is a Sheriff's Department page, and there's a Security Services division, which does track jail-related data, and the COVID-19 data is there as well. Similarly, UW-Eau Claire has a lot of good local data on their website. We continue to work closely with UW-Eau Claire. About 13% of cases since September have been connected to UW-Eau Claire. And so we continue to work with them closely to track data. Their testing is really an important asset in this community for students, faculty, and staff. They do regular testing there, and we work closely with them as they identify people that are COVID positive. In Eau Claire, we now have 40 active public health investigations. Again, that's where we have disease happening in some of our very critical institutions like long-term care facilities, and where we are seeing a pattern of disease in other places like schools and businesses and other work sites. So 40 active cases currently. 40 active investigations currently. The state rating for COVID-19 activity level is now at high, and that's a downgrade from the very high activity level that we've been at for many, many weeks now. It was 5 months that we were at that very high level. So good news again, that's directly related to our case numbers. So as our case numbers have gone down, we've been hopeful that we would move out of that very high activity level and into the next level down, and that's happened this week. That high means over 100 cases in a 2-week period. And we are technically at about 103 for a population of our size, but we've had 344 cases in 2 weeks. So again, we hope to get below that 100 cases, so we get out of the high level. With 344 cases, we're going in the right direction, though. Our trajectory of cases, so how much we're going up or down, is at a flat level. So we're also encouraged that we are not increasing our case numbers the last couple of weeks, and we're hopeful that that trajectory will start showing that we are declining. Our positivity rate by test is at 6.2%, slightly down from last week, and again, in a much better spot than we have seen in November, December, and January. Our testing is steady. We're still at a little over 400 tests a day for Eau Claire County. Those numbers are low. We do have a level of concern about that. We continue to encourage people to get tested. If you are in close contact with individuals that may be COVID positive or in regular close contact with people, we really encourage you to be tested. There are plenty of tests available. Certainly, if you have any level of symptoms, please get tested. That'll be the best way we know about how COVID spread is happening in our community. And it will be the best way to slow it down, which I think all of us, schools, businesses, healthcare, all of us want that slow spread to continue. Our regional hospital bed capacity remains good. Our inpatient beds have been at green for some time. ICU bed space remains at the red level, so concerning, but certainly they are managing well there. Community spread for COVID-19 in Eau Claire County is at 39% of cases. That has remained primarily steady over the last number of weeks. And we are getting in, from a public health standpoint, to most of the cases to do the interviews that we do and to do the follow-up to make sure that those individuals understand why it's so important for them to stay home and why it's so important for their close contacts to stay home, so we slow the spread. So we're at 91% of people who test positive that get a call from the health department within that first 24 hours. We certainly reach out to everybody. Sometimes it takes us a bit longer than that 1-day period. Again, you can look at all kinds of testing data on our website and follow the weekly report of some of those measures that I just shared with you, those red, yellow, and green measures. That's available also on our website. A state data update, as we typically do. We are now over 500,000 cases of COVID-19 in Wisconsin. We're at 553,110 as of today, an increase of more than 6,000 since last week, Thursday. Our active cases are close to 13,000 of COVID-19 cases in the state. State activity level has also gone down to the high level rather than the very high level. So again, we're seeing that same pattern across the state in most counties and at a statewide level. We now have 6,140 people in Wisconsin that have died related to COVID-19, an increase of 148 since last week, Thursday. So again, a milestone, getting over that 6,000 mark of individuals since the start of this pandemic. Again, a serious number, one that we can't take lightly. It's an enormous volume of people that have their family, their friends, and our communities have been impacted by the loss of those people. A couple of announcements and a couple of updates that we'd like to also share. Probably the biggest news that is predominating our world in COVID-19 is about vaccine. It's a really important part of our process in getting to a place where we have more ability to be moving back to what we were at a year ago, where we weren't talking about COVID-19 every day. Our vaccine volume is limited, and I do want to make sure that people clearly understand that our goal continues to be 80% of those people that are eligible to be vaccinated get vaccinated. We want to get close to that herd immunity in this community with vaccination. Some people are not eligible to be vaccinated at this point because of the vaccines. You have to be 16 years old and older. Many people are not yet eligible based on state requirements to get vaccinated at this point. And again, I think most people are aware of the groupings that are approved to get vaccinated right now. That includes individuals over the age of 65, as well as those healthcare workers and law enforcement and fire who have previously been named by the state as eligible to be currently vaccinated. The state is getting limited amount of vaccine into the state. They distribute that across the state, and I'll share a little bit about our data right now, but we are getting vaccine in Eau Claire, but it's not sufficient to meet the need of all of our 65 and older population or all of the others that are currently eligible in that healthcare workforce. All of the vaccinators in Eau Claire are getting through as quickly as possible all of those people that present for vaccination that are eligible with all the vaccine they have. So we have a good team here in Eau Claire. It's a positive that we should all be proud of. We have vaccinators that are asking for vaccine, are setting up processes to give it, and are giving vaccine. That includes the health department, but it also includes our healthcare system partners, many pharmacists, and others. We know that an efficient way to get vaccines in arms is to do those bigger mass vaccination clinics, and we're prioritizing that locally as our strategy with the health department. We want to get a lot of people through in a day and do that efficiently. And others are doing a similar strategy across the state. We will keep working on every way to get vaccines to people across this community. Starting soon, we'll have also a vaccine location in Augusta as an example of how we are trying to get vaccine out to locations that don't otherwise readily have vaccine available. So do know we are meeting weekly with all the vaccinators. We are making sure that we have shared information that's on our website at the COVID-19eauclaire.org website. If you go to that vaccination tab, you can see all of the vaccinators that are currently publicly giving vaccine. We are also coordinating with new vaccinators that are coming on board. So you may have seen the announcement that Walgreens, including the two of the Walgreens in Eau Claire, will be receiving federal supply of vaccine. That direct federal allocation will be a very small amount to start with. Do know that Walgreens is working through systems to develop an appointment schedule for that. Again, very small amount of vaccine that they're currently going to be getting from the federal supply, but it's a bit more vaccine coming into Eau Claire County, which is good news. We ask everybody to, as they are eligible and as they make appointments to get vaccinated, that they make one appointment and they stick with that appointment. We are hearing from providers across Eau Claire County that individuals are not showing up to their appointments because they made them at varieties of places and then aren't canceling as they may find, for whatever reason, a different appointment available. Please make one appointment, choose your route to get vaccinated, make one appointment and show up. It makes an enormous difference for all of us in the efficiency that we have locally. All providers of vaccine are really struggling a bit with this right now. So please know that we have limited vaccine. Make one appointment and please show up so we can get that vaccine in your arms. And know that we are working hard to make that happen as quickly as possible. In Eau Claire, there's, first of all, new data available for everybody on the state website and now on our Eau Claire County website. It was released today, and that's county level data that has more information in it than just the number of doses that have been given to Eau Claire County residents. We've previously reported that data point. That's the one that we had. Today, we have 18,830 doses that have been given to Eau Claire County residents. We now have more data than that people can see at our website, but I'll share a couple of the items of data from that additional data on the website. We now have 14,107 Eau Claire County residents that have gotten at least one dose of vaccine. That's good news. We have 4,636 individuals that have gotten both doses. Do remember that the first vaccine available about a month ago was really for healthcare workers. So those first people that have their 2 doses in are primarily healthcare workers in this community. And we have many healthcare workers that live in Eau Claire County. We're a healthcare hub, and many people live in Eau Claire. We do know that we are, again, according to this dashboard, doing reasonably well compared to the rest of the state about the percent of our population overall that's been vaccinated and the percent by age group, which is something that you can see on the map that the state has on their website and we have on our website now locally. It does show that 4.4% of our residents in Eau Claire County have completed their vaccine series. And 13.5% of our Eau Claire County residents have gotten at least one dose. You can also look at that site to look at 65 and older population as an example. So we encourage you to look at that. It's something that we're watching very carefully. We want to make sure that Eau Claire County continues to advocate for getting our fair share of vaccine. And you'll see on the map that we're doing well with that. We are actually doing much better than many counties in the state as far as how many doses are being administered to Eau Claire County residents. We do also know that our next group that will be eligible for vaccine are educators. So that's childcare workers, K through 12 educators, and higher education, both CVTC and UW Eau Claire. Are in that next group. Again, we have a very large population in Eau Claire County that will be eligible in that group. Again, we will have limited allocation of vaccine designated for Eau Claire County, and we are working now with those groups. We've talked to all of them, provided basic information to them about vaccine resources, what they should be doing within their institutions to prepare, developing their lists of employees and their processes for how they would like vaccine to happen with their institutions. And that work is ongoing and has been happening over the last number of weeks with very close connection between Incident Command, the health department, and all of those institutions. Others will also be eligible in that 1B group. So certain types of essential workers named by the state, which include utility workers and IT workers and others, individuals living in certain congregate settings like jail and shelters, and other groups and organizations that have been designated as being at higher risk and at higher priority for the state to move forward in the next vaccination group. People in that 1B group are in the next eligible group are not eligible yet, and so are not yet able to have an appointment to get vaccinated, but soon will be. We anticipate sometime on or after March 1st. If you're eligible for vaccine, and we know that many people still are and have not gotten in, please find appointment information on our webpage. If you're someone that struggles with accessing a webpage or accessing the resources that are available with the electronic appointment scheduling systems, do know that there are phone options. You can call our call center number. That number is 715-831-7425, and we will help support getting a vaccination appointment for you. You can also call the Aging and Disability Resource Center. And again, that information is all on our website. We do know that some people may need some help signing up for an appointment, and we don't want that barrier to exist for you. We also know a new topic, not a vaccination topic, but that there was new guidance from CDC about quarantine following vaccination. So individuals that are 2 weeks past being fully vaccinated, now the CDC has announced will not have to have the same quarantine requirements that others that have not been vaccinated currently have. The state is reviewing that information, and we expect either later today or tomorrow for them to come out with state-specific guidance. As a health department, we have to follow what the state says. We anticipate that they will follow the CDC guidance, which does mean that someone that is fully vaccinated 2 weeks after that time frame, and the 2 weeks is because they need to build up immunity, they will have different requirements for quarantine if they're a close contact to someone that is COVID positive. You'll see more information available on all of that guidance at our website, covid19eauclair.org. So with that, I'll move to some of the questions that were asked in advance, and then we will go to any questions that the media has for us. So first, with vaccine rollout underway and daily case numbers declining, are we en route to herd immunity? We hear a lot now about herd immunity. Probably a year ago, many people didn't know exactly what that was about. And it's an important concept in public health and in communicable disease prevention. We, through vaccination for many diseases, work on getting to herd immunity. For COVID-19, we have that same framework. So again, as I said earlier, our hope is to get to about 80% vaccination. Near that, to consider some level of safety. We'll also be looking at population level percentages. So certainly those that are at highest risk, those over the age of 65, and the reason they're prioritized first for vaccine is because we want those rates to be very high in that population, the ones that are most at risk for the potential for hospitalization. So we'll be watching both of those numbers. We also know that people that have been infected with COVID-19 and people that have been vaccinated, there is still not clarity about how long that immunity, that herd immunity lasts. That is still something that is being studied, a reminder that this is really still a disease that is being studied carefully nationally and internationally. We are hoping that if we can get to high rates of vaccination, combined with the fact that we, yes, do have people that have been COVID positive, that we are on the way. We have a ways to go, and much of that's going to be dependent on the amount of vaccine we have available in this community. Again, we don't have sufficient vaccine to get it into the arms to get to herd immunity yet. We have capacity. We have people that are really willing and able to vaccinate. We're waiting for a vaccine to be available. Another question related to a topic that we have talked about a bit before, but related to masks. The CDC recently came out with more information in a study this week on wearing of 2 masks versus wearing of 1. There is data to show that that is potentially helpful. It also, frankly, comes down to wearing a good mask, one that fits well, is double layered, and that you wear at times where you are in close contact with others. If we don't first make sure that in this community we make it a regular habit to wear a well-fitted mask over our nose and mouth, and one that is worn in all places where we're in contact with others, frankly, that has got to be our first effort. If you have a mask that for whatever reason doesn't fit quite snugly, if you have a mask that maybe isn't the quality that is considered that closely woven, double layered mask, wear a second one. It will help. The CDC information does show that. But certainly at this point in time, the state recommendation and our recommendation remains the same. Closely fitted, double layered, tightly woven mask. We then also got a question about some conversation with Sheriff Kramer, the sheriff in Eau Claire County, and mask citations, and really what enforcement is happening in Eau Claire County related to the state order, or if we end up having a local ordinance in place, what does that look like and what does that mean? And is it important to have an order or ordinance if enforcement is not happening? It is true, as Sheriff Kramer described this week, that enforcement of the current state order has not moved forward with issuing through the DA's office the current process for a state order with any issuance of any consequence for a non-mask wearer. With our local citation authority, if we have the need for that, Again, the process is not to be handing out citations. The goal is mask wearing. The goal is shared interest in this community to make sure that we all understand that we're all going to be in a better spot. Businesses, schools, families, and healthcare, if we wear masks when we're out and about. It's to all of our best interest to do that. The health department has been and will continue to be the entity that does follow up on any complaints we get or any referrals we get from law enforcement. Law enforcement is one of the partners working with us to provide information to us about places that do not appear to be adhering to the basic practices of related to following the mask ideas in this community. So the health department has been and will continue following up when we get those complaints or referrals from law enforcement. They are a partner of ours, but they are not currently and will not be in the future if and when we have a local ordinance that is going to be enforced. They will not be the ones that are actively looking for that in the community. They'll partner with us, and we're confident that they will do that. But it's really been, like other public health measures, a public health approach to educate, and only in those most egregious situations follow up with an enforcement action. We then also got a question about whether or not we got 100% of the doses that we requested for COVID-19, and what percent of vaccine that's requested for Eau Claire County is actually received. It isn't currently information that we are getting except for our own ask for doses as a provider, as a clinic that provides vaccine. For our Eau Claire County, our health department clinic, we got 20% of the doses that we asked for this past week, so a very small percent. We meet with all those vaccinators, and they regularly report to us that the last 2 weeks they've gotten significantly less, again, closer to that 20% of the ask of the doses that they've asked for. It is one of the things that we are looking at county-wide. The data that we now have that shows how our county measures up as far as the percent of the Eau Claire County population that's been vaccinated is one of the ways we check to see if are we getting about the fair share of vaccine that we should be given our population. We continue to work with the state to get the actual allocation information, and that'll be part of the work we do together. Do know we're asking for vaccine. Do know that we are not, any of us as vaccinators, getting all, or in some cases, any of the vaccine we have asked for. We also have a question about our case numbers and our hospitalizations. So why might it be? Because even though case numbers and hospitalizations seem to be going down, our death rate remains a concern. As I shared with you earlier, we had 6 more individuals, Eau Claire County residents, that died related to COVID-19 in the last week. There are likely a number of reasons that this is true in Eau Claire County. It's very difficult to name a specific reason that our hospitalizations and case numbers are lower, but our deaths remain significant. It is a lagging indicator. We know some individuals are hospitalized and are treated for many, many weeks, and many of those individuals are able to be discharged and further recuperate at home. Unfortunately, after many, many, many weeks of treatment, some people do die. So our increases initially in hospitalizations, those first hospitalizations, some of those people remained hospitalized from December on, and some of those people are dying. So that is part of the factor, not entirely. It also may be possible that we have more disease spread in this community than what is noted, and people are dying with either limited hospitalization or without being tested at all. And our test numbers are low, and one of the possibilities might be related to that. Again, there are many reasons that we are seeing deaths, and our goal continues to be to keep our case numbers low, to know about disease, so making sure we get tests happening, and to make sure that people get the treatment they need as quickly as possible if they're a case. It is possible now for many, many individuals, if caught early enough, to get treatment now that is shown to be fairly effective. So please, if you are tested positive and have symptoms, talk to your healthcare provider about effective treatment that may support people not being hospitalized and, in the end, not dying. And then finally, we have a question related to the contagious variants that the more contagious variants that we are seeing across the nation and certainly in Wisconsin. We had a second case of the UK variant being identified in Wisconsin, and we know that those variants are in our state. The question is it reasonable to assume that there may be additional surge of cases across Wisconsin with those variant cases? It is a strong possibility that we may see more cases with this more contagious variant being in our state. We are expecting some increases. The ways to avoid that is to make sure we're using the basic mitigation strategies. Those same strategies work: wearing a mask, keeping distance, staying home when you're sick, getting tested. Same things with this variant strain. If we really lean in hard to do those things, it will make a difference with the variant strain as well as those cases that are positive with the non-variant strains of COVID-19. So again, we'll be watching. That's part of why we are paying attention to our case numbers. We're encouraged that those numbers are remaining low right now, and we hope to continue to see that. So with that, I will ask Audrey, did we get any questions from media that came in through chat?
No additional questions in the chat box. Is there anyone online who would like to unmute and ask their question directly?
All right. Thank you again for joining us. We appreciate your time. We appreciate what Eau Claire County has been doing to really make a difference. We all want our businesses and schools and our institutions and families to function as completely as possible. And the more we pay attention to spread of this disease, the better it will be. And we're seeing that difference being made in our community. So thank you for that. If you have additional questions, please go to the COVID-19 Eau Claire website. You can also call the call center, and a reminder that that's a resource to all of you. That's 715-831-7425. We will be back next week on Thursday, February 18th to share more information with you then. Thanks very much.